I'm Brad Deichler, the Chief of Police here at the Medical Center. Several law enforcement officers were brought to the Medical Center for treatment after an incident, and I don't have the numbers that I can release. Detailed information will come from the PIO from Kansas City, Missouri Police Department that is doing the investigation at the scene in conjunction with KCK. Normal operations at the hospital continue. Family members and those that are coming to the hospital to check on their loved ones are also being accommodated. But we very much appreciate if you direct any additional questions or seeking any additional information to the PIO from Kansas City, Missouri Police Department. We'll be at the scene at 18th and Parallel in just a few minutes for a live statement.
And Dr. Kumer.
Yes, thank you, Chief. Yes, I'm Dr. Kumer. I'm the Associate Chief Medical Officer. We are currently treating and evaluating and managing multiple police officers here at the University of Kansas Health System. They all have non-life-threatening injuries at this point and are hemodynamically stable.
Are there any other questions?
This is Abby from KSHB 41. Can you guys hear me?
Yes, we can.
Yes.
Can you give us any information on the type of injuries that these officers sustained?
We can't elaborate at this time. They currently, like I said, non-life-threatening injuries. They are all hemodynamically stable and able to converse very well with our medical staff and our trauma team.
And a follow-up question here, are you guys also treating any victims in this officer-involved shooting?
We do not know that at this time. It's still under investigation.
It's being assessed.
Chief,
Is there any other questions?
Yes, Chief, this is
Go ahead.
Betsy Webster with KCTV, and I know you can't speak to any of the investigative details since KCMO PD is investigating that due to it being an officer-involved shooting, but can you speak a little bit to the thinking of you and the officers right now, knowing that you have multiple officers being treated and knowing that they will hopefully, it sounds like, be okay. I know you've had a number of officer-involved shootings that have been fatal in the past 20 years. So your thoughts?
Yes, I can tell you this, Betsy. The law enforcement community and the first responder community come together in a situation like this. This is really hard on the police officers. It's hard on their families. It's hard on the medical staff here treating the folks that have been injured. So it's an emotional time. I am very familiar with the folks at the agency involved. They're going to get support from lots of places, but it's super hard for everybody involved, for the officers that are injured and for the people that care about them.
Thank you, sir.
Welcome.
Last call for questions.
Yeah, this is Todd Palmer with KSHB. I just wanted to double check to be clear. Are you treating 3 people with gunshot victims, or are there more than 3 people being treated with gunshot wounds at this time?
We can't comment on how many are being treated at this point. I can just tell you we have multiple victims that are all stable and under treatment and still being assessed for their next steps of care.
Dr. Andy Alcock, ABC9 News. Wanted to ask, I know you can't identify these individuals. Can you tell us if you have males, females, if family members are here or notified? You said that they're conscious and talking, correct?
Again, I can't comment on that now for privacy issues, and certainly talking to their families and so forth, that's going to be handled by the KCMO and KCK police departments.
Based on what you've seen, do you expect that these folks are going to be, you said serious, do you anticipate they're going to have a fairly lengthy hospital stay, or how long do you think these folks might have to stay in the hospital?
It's difficult to say at this point. There are various injuries. Some are less serious than others, and the medical teams are certainly still assessing, and it's very early. Can't tell at this point. Some of the folks are still being undergoing some diagnostic testing.
All right, then. We want to thank you, reporters, because you do a very, very important job in something like this when it happens. So we really appreciate your interest. We also appreciate you tuning in for a virtual conference. I want to thank Chief Deichler and also Dr. Kumer for taking time out to answer questions. These guys are really busy, and they've got to get back down to the emergency department. A reminder to the news media, this is the only update scheduled for tonight. You may bring questions tomorrow morning on the morning medical update. Same BAT channel. If there's something that we need to update between now and then, we will reach out to you, and our media team will send a summary of this conference shortly. So we invite you to watch for that. This concludes our news conference. Thank you.